2024 as we discuss barriers to HIV awareness and treatment access in Nigeria. This morning we're joined virtually by a consultant of the blood safety value chain, Dr. Oyetunde Akinloye, who joins us virtually. Hello, Doctor. Good morning and compliments of the season.
Good morning, sir. How are you?
Very well, thanks for asking. And let's get straight into the conversation, considering the burden of HIV and AIDS Nigeria struggles with, particularly in terms of mother-to-child transmission. And with the 2024 commemoration of the World AIDS Day, we're back to this conversation again in a time when persons are talking about access to treatment, particularly prophylaxis to those exposed, and also in terms of the awareness on how to curb mother-to-child transmission. Dr. Oye, did you get my question? We're trying to get you, we're hoping that you have not muted yourself, or if best you could take out the headsets and let's see if we could hear you. There's some challenge with your audio. We're hoping that you can unplug your earphones and check that you're not muted. Now, whilst Dr. Oye is trying to get his audio sorted out, it's important to point that statistically speaking, Nigeria's numbers are not doing too well. And Chijioke, if you recall, we looked at it together on Friday, and it's more sad when you find children born with the virus at such a tender age having to live with a immune system that has been suppressed by HIV, making them susceptible to a myriad of diseases.
Well, certainly. I think on Friday, while we were checking out the statistics, it said that about 140,000 Nigerian children are currently infected by HIV or so, and that 22,000 new mother-to-child transmissions of HIV happens yearly. And globally, Nigeria contributes 25% of the global burden of HIV mother-to-child transmission, which is not a very good figure when you take a look at the broader, global picture. Contributing 1/4 of the entire figure is quite alarming. And I honestly think the Ministry of Health, alongside the National Orientation Agency, should team up to ensure that more awareness, more sensitization is done to ensure, prevention of transmission from mother to child. That's one. I believe with proper medication and treatment, mothers could give birth to healthy babies that will not be born with HIV if that is done.
All right, let's see if Dr. Oye has his audio sorted out and can rejoin the conversation. Hello, Dr. Oye, can you hear us now? We still cannot hear you, Doctor. I don't know if it's because of the headsets or you're muted on your own end, but check that on your screen, you're not muted though. We'll keep on trying to see if we can have you rejoin the conversation in a bit. But now, much like Chijioke has highlighted, the statistics are quite staggering. And from some of the awareness that persons can find out, simple practices like knowing your status has also been a challenge. And it's not news that in Nigeria, persons living with HIV are given a certain discrimination. The stigma associated with it is also a growing concern. And as much as we're encouraged that we should test regularly for STDs beyond HIV, the challenge is when it comes to the neonatal stage of life with mother-to-child transmission. Now, quite strategically, like Chijioke highlighted, the Ministry of Health in Nigeria, on the Minister, Dr. Ali Pate, had also talked about plans to ensure that women who are pregnant in Nigeria have access to free cesarean section. Now, cesarean section in childbirth has also been given the nod in terms of reducing transmission from mother to child. But beyond that is also breastfeeding. Now, for those who are in Nigeria, you'd know that it is not news how expensive formula feeding is. It's cheaper to breastfeed in some sorts. But with formula feeding, which is also another step in reducing this transmission, these are two key issues that also have implications on the drive to reduce mother-to-child transmission. So, in analyzing the calls from the minister, I saw many Nigerians asking, would these services be domiciled with general hospitals in terms of the free cesarean sections?
Yeah.
And if so, how many women have access to these hospitals owing to the challenge with primary health care access in Nigeria?
Well, apart from the challenge to primary health care in Nigeria, another prominent issue that most Nigerians have when it comes to proper and affordable access to proper health care is the issue of NHIS. Many Nigerians, well, most civil servants, either in states or the federal civil service, do have access to NHIS, but people who are not part of the entire civil service structure might have a little bit of challenge gaining access to subsidized or even free health care via the NHIS. And if they are going to subscribe to private HMOs, these do not come cheaply. I mean, if at the end of the day people want to subscribe to HMOs, they might as well just go via the regular route of just going to the hospital, paying for the services that they are supposed to pay for, in cash and all. And in terms of providing free cesarean sections to pregnant women who are about to deliver, it's a move in the right direction by Professor Ali Pate, in as much as whatever it is has its own up and down sides. At the end of the day, you cannot rule out the benefits of this sort of philanthropic gesture by the Ministry of Health towards the poor and vulnerable in the country.
Now, it's also important to note that this conversation is a two-pronged conversation. Whilst the basis for it is on the awareness created on HIV, there have been programs in Nigeria over time in the last 3 decades that have harped on increased awareness on HIV prevention. It's as simple as ABC, if many would remember the APC principle. A being abstinence, B being faithful to one partner, and C in terms of those who choose to exercise their sexual independence with the use of condoms. Emphasis on safe sex. But the other angle to this conversation is on treatment access in Nigeria. This morning, if you remember, among some of the stories we read out, there are plans to begin to roll out a long-term injectable HIV prevention drug in Nigeria. Now, we're told that Nigeria is commencing the cabotegravir long-term acting injectable, known as the CABLA, part of HIV prevention in Nigeria. And whilst this is conversations that are beginning to be had, many would also remember that there's also prophylaxis, which is supposed to be given within hours of exposure. On the one hand, for those who are sex workers, on the one hand, for those who work in the health space who suffer needle injuries. Now, these are also part of the contributions in terms of treatment access. However, in terms of the drugs taken, because HIV and tuberculosis have correlationships in terms of their infection rates.
Yeah.
Some of the drug volumes are quite high, and in getting those who are living with the virus to be compliant in taking their medication, it is also a huge challenge. Many are asking, are there ways that this access to this cablas and the awareness also can be created in the non-health spaces? Because these are health conversations that are mostly technical. Persons within that space are probably not even aware, in one, and secondly, do not even know that they can have access to these drugs.
Well, the sensitization is the major thing in this situation, Beto. If people are sensitized in terms of knowing that they can actually go to public hospitals and have free access to either PrEP or PEP, of course PrEP to ensure that they prevent themselves from contracting the virus, and PEP for post exposure to the virus. And it's a knowledge that is not very common amongst people, and with the stigma surrounding the topic of HIV, it's not something that is openly discussed amongst the people anywhere in the world, not just even in Nigeria. So, but if these conversations are had more comfortably, if these conversations will be had more openly and more in a more relaxed way, I think the information will get down to the grassroots where people can know that hey, you know what, if you are going to exercise your um sexual what was it you called it,
Liberty.
liberty, you know, ensure that you go to a healthcare facility, ask for prep. I think prep is the one before, you know, take it over a period of time. It helps in preventing, it's almost like a vaccine that helps one from contracting the virus. And if you think that you might have been exposed to the virus in any way, within a few hours, well, I think I read it somewhere that is usually within 72 hours or thereabouts, you can actually go get the PEP, start the medication, take it for about 30 days, and then wait for probably 3 months or so, do your test, and if the test results come out clean, then I think you're good to go.
Now, it's also on the access to safe blood during transmission, because there's also different angles of the conversation. Blood screening, which is part of the purviews and the area of expertise of Dr. Oyetunde Akindoye, who is looking to join us. He will talk to us more on that. But in the interim, whilst we wait for doctor's connection to stabilize, let's retry that we have a good connection. Hello, Dr. Oye. Good morning to you once again. Can you hear us?
Good morning, sir. Can you hear me now?
Perfect. I can hear you now. Compliments of the season.
So I wish you the same.
Now, let's get into the conversation. My colleague and I have looked to establish the burdens Nigeria deals with in terms of HIV, and why over 3 decades later, we're still having conversations about barriers to access to treatments and HIV awareness.
All right. Yes, that is true that access to treatment and access has a lot of barrier. And then if we are going to look at it holistically, there are ways to tackle that. It wasn't that the awareness was not there. Awareness has been there right from the onset, but there's need for aggressive awareness at this point in time, either to the community or faith-based organization like church, mosque, and then the use of media that will also help to create awareness and to remove stigmatization from people who are living with HIV/AIDS and those within the community. And then when you talk about the stigma, it's not only from people, it can also be from an individual. That also reduces access, because someone with HIV who refuses to go for testing is already having self-stigmatization. And it's because of what people will say that makes some not to go. And if you are not tested, there's no way you can be treated. And to improve that, it requires a lot of aggressive awareness, training, and then encouraging people and also showing them love that they belong to the community.
Well, doctor, for people who do not really want to go to a public health institution to have themselves checked for HIV due to the self-stigmatization that you have mentioned, I believe
Yes.
Alternatives such as the self-test kit, HIV self-testing kit, is also there. However, the major concern here is about the pricing. From research here, I saw that these self-test kits could go as high as 5,000 naira or even more. And for people who cannot afford such amounts of money for self-test kits and are also scared to go to the hospital, what will be your words to them? And is there any other alternative in any way that you think we could overcome this?
Yes, there are alternatives. Only that the alternatives, they are short-lived, in the sense that the like non-governmental organization like IHVM, who are into community, they have a community department in that institution, whereby they go to community and then collaborate with the arrowhead in that community, like the chief of the palace or the emir, and then carry out this free testing for people. But as rightly said, in that kind of community, people will not want to come out because of the same problem, stigma. However, if the self-test kit can be distributed at the pharmacy level or within the palace itself that people can just pick, go home, and check themselves. Maybe that may be another way of looking into it. Just the way condom was distributed in those days, whereby even when you enter toilet, you see condom, you can pick and do it yourself. And that reduce the transmission then. So this self kit can also pass through the same mode, but the problem now is will people know how to do self-test without training? And that is the reason why I said there's need for training. If you carry out community training, and then we now distribute to people that you can go home and check yourself, that may work.
Now, doctor, in looking at it from the angle of within the healthcare system as well, patients are or persons living with HIV are not given the gospel of suppressing their viral load by staying on their medications quite too well. And this has also been attributed to the fact that we are unable to bring down the transmission burden in Nigeria because such patients have not been able to actively suppress their viral loads. In keeping with medication dedication, how do we get this person to be more dedicated to taking their medications as at when due?
Oh, that's another gospel. It's like asking a chief imam or pastor to go and monitor the brethren in their various home. So it's a tough, it's a tough organ.
That's a good analogy there, doctor.
Yeah, it's because in the sense that the medication has been given, it's the responsibility of the beneficiary to do that. But all that the doctor can do is to encourage and give them the pros and cons that if only you can do this, these are the benefits. But otherwise, this may happen. So, and then maybe if they have some people do come with their relatives, and that relative can also be another encourager who will now encourage the individual that mommy, dad, uncle, sister, don't forget your medication, whereby you remind him day in, day out. That is one. Another way is if this individual is attached to a caregiver, whereby now we are using media now in the current dispensation, whereby the phone can also alert the individual at different time when the medication is supposed to be taken. So it's one thing for the alarm to ring, but it's another thing to actually act accordingly. So either way you lose. All that matters now is that the individual who is living with HIV/AIDS, who has been given medication, should be encouraged to take their medication as at when due. But to monitor them outside the hospital is going to be a little bit very difficult.
Well, doctor, I just want you to react to this rather worrying statistics from the Guardian newspaper sometime last week about the rate of HIV infections in children. Now it says that about 140,000 Nigerian children are currently infected by HIV. 22,000 new mother-to-child transmission of HIV happens annually. And in general, Nigeria contributes about 25% of the global burden of HIV mother-to-child transmission. And 15,000 deaths recorded among children yearly, 300 of which occur weekly. All of these figures are here in Nigeria. How worrying is this? And should this call for some sort of emergency in the healthcare system, especially when it aligns with the issue of HIV and AIDS?
Definitely, it's called for an emergency. In the sense that when you look at our population, and we are talking about 140,000, 22,000, and before you know it, these are within the community. And if it's not properly handled or controlled, the thing may escalate from that 140 and go up again. And these are, because with the information you are giving now, these are data-driven evidence, whereby through the monitoring and evaluation, they'll be able to gather all this information. The fact still remains that the mother-to-child transmission is supposed to have reduced because there are a lot of approach medication to that, whereby even a woman with HIV/AIDS can give birth to a child without HIV. It's still bogged down to non-compliance on the regimen of the management and treatment of this individual. And sometimes when people just take medication for a while and they got relief, they believe it is over. But if it's not completed, also turn to drug abuse. And then the regimen that was given before may not work again by the time that individual return back to the facility. So based on that, in order to reduce this, there's need for emergency, there's need for, that's why I call it aggressive awareness, whereby every hand will be on the deck to ensure, because we are talking about one health, one community. If anyone in the community is not healthy, that means it can as well even transmit to other, and then before you know it, one turn to two, two turn to four, four turn to eight, and that's how the number increases. So in order to ensure that we have an healthy community that will give us a healthy environment, we need to be aggressive in creating awareness and encouraging our people who are living with HIV/AIDS to at least get themselves tested, treated, and also adherent to the management of their situation.
Now, talking about onward transmission, doctor, it's important to restate that we know HIV to be an opportunistic infection where tuberculosis and HIV are now co-infectants. But for TB, there is the role of contact tracing. Is it possible that as health practitioners, there might be room to explore a contact tracing scenario between patients living with TB in search for HIV, thereby broadening the search net for persons living with HIV?
Yeah, contact tracing is possible, but it doesn't mean that we have to be truthful to ourselves, because the use of stigma will also bring a barrier to that. Remember when we have Ebola in Nigeria and we do contact tracing, then you are at least you are a journalist. You got to know that it was a bit easier because the thing happened in a private facility where they have proper documentation. In a situation where you don't have proper documentation, contact tracing become a problem. And documentation in any medical facility is a recurrent decimal. It's the only way, whereby you'll be able to know who has get in contact with this individual and the family. And remember, the family are not just in one place. They will move from one point to the other, get contact to another person. And when you talk about TB, we all know how violent it is. But for the HIV, it's either transfusion or through sexual mix or direct infection by practitioner within the hospital environment. So contact tracing is possible, only that it will require a lot of aggressive approach, whereby you must have proper documentation to trace the people who has get in contact with that individual, and in one way or the other, to get them also tested, and where need be, treated, and also encourage them to be free within the system.
Now, doctor, we're talking about some interventions that can also be had to reduce the transmission. And in Nigeria, listening to the Minister of Health, Dr. Ali Pate, who talked about free cesarean section for women who need it, he also talked about the fact that HIV mothers can have HIV negative children who are free from the virus. Do you think this will play a role going forward in curbing mother-to-child transmission?
Yes, because of the free cesarean section being introduced, even the local area where people are not, they doesn't have financial muscle to carry out that particular cesarean section. Now that it's free, people will be free to go to the hospital and to attend antenatal, and for every antenatal, there's also a pre-screening to know the status of that individual. In my opinion, I believe it is the right step in the right direction. It will help and also reduce the burden, financial burden from the patient.
Now, another intervention before my colleague asks you his question is on the long-term HIV preventable drug, Kabla. We hear that this morning Nigeria is also getting ready to roll it out. Is this supposed to be for persons who are sex workers or frontline workers in dealing with the virus? And how would this help Nigeria in its fight against the virus?
Well, Kaplan will be of help in as much as you are able to prevent the environment from the virus, either the frontline workers, either in form of what you call PrEP, that is prophylaxis approach, or post prophylaxis approach, either of, or those that have been tested confirmed. This has to be holistically looked into. Policies are good, implementation is a problem. So at implementation level, we have to define who and who are we looking at in these categories to use this particular drug that we are talking about. And then don't forget that when this kind of drug is being distributed, even through the NGO, when they are distributed to some hospital, you realize that they only find them on the shelf in the pharmacy. And then the people that actually need the medication will not get access to it. So that's where implementation comes to play. Who is going to monitor? Who is going to ensure that the end user, the beneficiary, actually gain access without any barrier, limitation, or hindrances? The government can provide, but implementation is where the trouble will be.
Well, doctor, let's talk about the commemoration of the World AIDS Day in general, which was yesterday. Are there any activities that maybe Nigerians should be looking out for, probably here within the FCT or across the country in other parts, in other states, in line with this significant event?
Yes, under the take the right path, which is just focusing on my health, my right, for individual to have their right. As I said, I'm aware that the ISVN, they are in community, and they are still going to community in FCT, because to create awareness and to also carry out on-the-spot testing for those who are willing and ready. That for FCT. And I'm also aware that back there in Lagos, activities is ongoing. So when you look across it's now going to be state specific. And the reason being that there are a lot of financial implication for people to move up and down.
Yeah.
So the NGO who are in different states has been duly informed to ensure that they carry out the awareness for people to be aware, and go to communities to also create awareness for people, both at the local end and within the state capitals.
Well, the awareness and the campaigns there would also be backed by free testing for individuals, you mentioned. Will there still be some sort of maybe support medications given to them? Are we seeing that happening, or is it just the test?
No, not just the test. For anyone that is found to be reactive at that point in time, they will be referred to facilities where they will get treatment.
Okay.
Now, doctor, following the work you do as a consultant in the blood safety value chain, blood screening, especially within the facilities, has also been linked to one of the interventions that can bring down the transmission. Often at times, do you have people who come in for blood donation who test positive to HIV or other STDs?
Definitely.
And at that point, is there a way to inculcate them into treatment early?
Yes, there's what we call algorithm, whereby initially, if a voluntary blood donor was found reactive, he will be invited again for retesting. Don't forget that a blood donor is a presumed healthy individual, is not sick. So the first test cannot label that individual as being HIV positive. So we have to do it again, minimum 3 times. And if it was found to be repeatedly reactive, then that individual will now be referred to treatment center so that he can access treatment. And where the need be, little support can be given, but it cannot be for entire life.
You mentioned that. Well, doctor, you mentioned that such tests would have to be done repeatedly for about 3 different times. If
Yes.
one test is done the first time and it shows that the person is reactive, doesn't that automatically mean that the person is HIV positive? Could there be instances where one test result shows a reactive reaction in the person, and then the next test shows that the person is non-reactive? Does that happen?
No. What I'm saying in this case is that when you come, you are talking about blood safety here.
Yes.
In blood safety, the test kit used is sensitive,
Okay.
highly sensitive, whereby no matter how minute the analyte is, it will pick. But for the testing at the facility level is specific. So when you do a blood test for a donor and you are using highly sensitive kit because you are looking at the other life, so you want to ensure and confirm that the individual that is reactive remain reactive before you label. This is just to ensure that you don't mislabel anybody that is not HIV positive to be HIV positive. That is the purpose. Because
Okay.
if
Okay,
I'm a
thanks for
bit
pointing that
analogy,
out. It's also important to ask because, as we know HIV to be an immune suppressor, most times there are
yes,
other STDs that persons are told how to look out for as telltale signs that their viral load might be towards the positive angle. What are some of these diseases, and what are the timelines in which persons who are found with these diseases supposed to begin their treatment?
well, for the HIV, once it's confirmed that the individual has the virus, treatment start immediately. That's the new algorithm for that now. So, and then for the same thing go with hepatitis B, C, and then syphilis. Only that emphasis is always on HIV, but hepatitis B is even more terrible because that is what we call liver enlargement, hepatomegaly. So when you talk about treatment, one is like if an individual is diagnosed to have malaria parasite, there's no point waiting. Otherwise, he may end up getting it tough than what he thought. So treatment, testing and treatment go hands in hands once it is confirmed.
Now, doctor, we're also looking at more diseases coming into that net. We're looking at HPV, we're looking at herpes as well. But for HPV, now that there are vaccines for girls between reproductive ages of 15 to 18, is this quite a significant landmark achievement in modern science?
When it comes to the vaccine for HPV, I just know it was introduced about how many months ago? Why? When they come to Nigeria, that people should take, and there's a lot of argument up and down that it caused this, it caused that. So, but I cannot blame anyone when it comes to vaccine for this and that, because if a madman has beat your mother, when you see a mechanic, you pick race. So,
Doctor and his analogy.
Doctor and his analogy. So, Doctor, carry on. Let us not disrupt you. Quite a very relatable analogy.
So, if you look at what happened some years back in Kano, so because of that issue, people are now more conscious to children, and at the end of the day, it gives a negative impact. So, with that experience, people are now becoming a little bit conscious when it comes to vaccine or no vaccine. And even when COVID came, if you look at it, how many people actually go or went for COVID vaccine in Nigeria? Some prefer that let COVID people kill instead of for me to go and take the vaccine. So based on the background and the experience, that's what makes people to be a little bit restricted that they will not. And if the vaccine is not given, you cannot do monitoring and evaluation to see the impact that it has in the life of people within the community.
Now, doctor, talking about breaking some of these cultural barriers and stigma associated with even vaccines, much like HIV, How important
Yes.
is it for persons to know that HIV is not a death sentence, and with a suppressed viral load, Nigeria can reach its target of zero transmission?
Yeah, as we speak, HIV is no more a death sentence. Even people are more afraid of getting pregnant than contacting HIV now in the current dispensation. Do you know that?
Well, to some extent, yes, doctor.
So you can see it's not like as it were before in the 90s, whereby even when you come out of laboratory, your colleagues even running away from you because you are going to look like a masquerade. So all that has reduced to a barest minimum. So the only thing that everything still remain creating awareness and encouragement with education and training. People, we got to know that once you know your viral load, you know at what level and whether you are making improvement or not. And the encouragement and love also help a lot of people even to sustain their life. What actually kills many people is not even the virus, it's just the thought of it that, oh, I'm having this. That's just it. But once they have people that love them, carry them along, and then they are within the community where they are cheerful and they are loved, their life is well prolonged. I have a lot of people like that.
Well, doctor, let's talk about it from the angle of, dieting, especially for people who have already contracted the virus, currently living with it and taking their medication. Are there some sort of specific meals to avoid or the ones to focus on in terms of, aiding the immune system and making it stronger to also complement the effects of the medication in the system?
When we come to immune system and the kind of diet in Africa, especially in Nigeria, you see most of our diet they are vegetable based. It's just now that people are now copying Western
Foreign
world where
cuisines.
so any once you are taking more of organic food, definitely your immune system will be boosted, will increase and improve. So they are only encouraged to ensure that they take a lot of vegetable, a lot of fruits, and that helps them a lot compared to just taking junks like flour up and down. So because I still know of somebody that I diagnosed far back 1993, and as we are talking, is still alive, doing well, and doing all that's required to do. And if you are not told, you may not even know.
Now, Doctor, you talked about education as a vaccine. Many are also saying that we
Yeah.
do not find prominent messages like we had in the 90s encouraging more people. In the 90s, was this as a result of the fear? Do you think that the lack of fear for HIV now has somewhat also reduced the intensity with which interventions and campaigns are carried out by NGOs and other HIV affiliated organizations?
Will I say, well, not really, but because of the resources, in the 90s, there happened to be a lot of NGO who are into HIV campaign, HIV AIDS. And then we also have an organization called PWA, People Living with HIV AIDS in Nigeria. So, and most of the campaign is always channeled through PWA then. And in the current dispensation, you know that even the Western world, they've reduced funding into HIV AIDS program, not like as it were before, hoping that countries specific should be able to carry on what had been demonstrated to ensure that they have their people well informed, educated about this pandemic. But in a situation where the resources is dwindled, because everything, all these things you are saying, without the money, there's no way you can drive them, and that is the essence of the campaign. But in a situation where the financial muscle is not available, definitely you won't be able to see campaign either in billboard, in a media house like your organization or radio or whatever means. That is one. Then another thing that in the 90s, the social media is wasn't polarized as it was today. So people also believe that with current social media, you can use TikTok, use this, use that to talk to people. But the question still remains, at the local level, how many people have opportunity to have the kind of answers that will be able to carry out all this social media we are talking about? So at local level, we still need one-on-one communication where human beings have to go there, talk to them, educate them, and let them know the impact of what they are carrying and the implication to the community at large. All these require traveling and require money. So these are just variables that need to be looked into and see what will be the best way to approach it in the current dispensation to ensure that our people are well informed about the virus and what will likely be the uh, probability of increasing the infection within the community if the right thing is not done at the right time in the right place.
Well, Doctor, you have pointed out sensitization at the grassroots level. You have also pointed out social media campaigns on platforms like TikTok, X, Facebook, and the rest. Another aspect that we haven't really touched on is secondary schools, especially because the youngsters in these schools are most susceptible to having unprotected sex due to their naivety and also lack of access to protection. How much effort is being put into ensuring that students in secondary schools are also sensitized and that the topic of either HIV or sex education in general is not a taboo topic in these schools?
Yes, that is ongoing. We used to call them catch them young. And then, so at secondary school level, although at initial stage, some people go against it that, they are too young. But in the current dispensation, secondary school is not young with what we are having in the world today.
Yes.
That is one. Two, at home level, parent also has a lot of work to do to ensure that their children are well informed. Because sometimes you think that that little girl does not know anything. But if you go deeper, you realize that this little person that you're looking at even know more than you think. So at home level, we have to educate our children. Then when you now get to the school, it not look like a taboo that, oh, daddy, mommy have even said it before. And they'll be able to communicate and at the same time contribute in the class when they are talking about sex education. But in a situation where parents had not even talked to their children, they believe that if they tell them about sex, this and that is a taboo. And they carry that kind of notion to school. They become somehow timid. And even when the teacher is talking about it, you see they will be bending their head on the table because they see that it's like, oh, this teacher is talking something out of order. So we parents, we have to also educate our children from home so that when they get there, they can easily link up with what the teacher is saying at the school level. And then, in the class, there is a way they're even going to present it because they're going to give the physiology of woman and they tell them in the very clear language that this is this, this is that. If you do this, this is likely to happen. So with that, education is now the continuous regime in the system.
Now, Doctor, in closing, we just want to find out if you have any, would I say, advice in terms of the key population programming and approaches that Nigeria should embark upon in our fight against the virus.
Well, as the policies are there, but policy require a lot of leadership to push it, and then also political will to ensure that they are done. Apart from that, at the facility level, there's need for proper documentation, there's need for monitoring and evaluation so that we'll be able to see the level of progress that we are making as a country in that direction. Apart from that, we talk about collaboration, we talk about reducing the stigmatization, we also talk about improving access. And then improving access, we have mentioned that barriers should be limited. If at all, we cannot eliminate it completely. So with that, I believe we'll be on the right track.
Well, Dr. Oye, is there a specific projection of a time frame given by the statistics that we are seeing now for HIV to be stemmed down to the barest minimum, especially in countries, African countries, and now narrowing it down to Nigeria? What should we be expecting maybe in the next decade or two, considering the fact that in the 90s, you mentioned that HIV was being feared more than it is being feared now. So in the future, are we seeing a complete eradication? What is your take?
Yeah, well, with the current thinking, we believe that everybody is saying by the year 2030 that will be a thing of the past. But 2030 is just about how many? About 6 years to come. So it's not impossible if we actually move aggressively to ensure that all these myths are removed and people are being sincere. Before you know it, it will be over. And you remember, even here in Abuja, in the day of what's the Prime Minister that normally use aircraft to fumigate Abuja then, El-Rufai, you receive that the hospital attendants, when it comes to malaria, reduced drastically. But assuming that was a continuous process, maybe Abuja could have been free of malaria. So those are the issues. It's the continuation of program that matters, not you do it now because there's change in batting is stopped. And that is what is affecting most of the program in the country. So 2030 is not that it's not achievable, but it requires